Very much.
Thanks, Carol.
Pleasure.
It's 16 minutes past 8, the rising cost of living. So it means that some people are being forced to skip meals or cut back, even taking vital medication.
Now, leading healthcare organisations are warning that patients are making choices that save them money but pose a serious risk to their well-being. Our health correspondent Dominic Hughes has more.
I'm just sick of having to make choices, and they have to be the right choices. If not, it's my health that's going to be affected at the end of the line, and I don't want to be any more poorly.
Laura has been battling kidney disease since she was 7 and has already had 2 kidney transplants, but now she needs another.
Yeah, so running the cost of the dialysis machine, it's constantly filtering the water, and that water just gets wasted.
She depends on dialysis, where a machine carries out the filtering processes that would normally be done by the kidneys.
Without dialysis, I think they'd say they live if you live past 7 days, then that's how serious it is.
Laura was having dialysis at home, but the machine uses so much electricity and water, the mounting bills have forced her to switch to a local hospital.
I would say that it's the straw that broke the camel's back, really, with the cost of running the dialysis machine, the water it uses, the electric. It was adding to my anxiety, like how am I going to pay to do this treatment every month? It's a very worrying time.
That's a lot to cope with.
Yeah, my little dog helps a lot with that. It's hard, but I've been ill a long time now, so I just try and live life as best I can.
And now GPs and frontline healthcare workers are warning rising costs are starting to have a much broader impact.
Those cost of living impacts are only just filtering through. The people who are on the lowest incomes will be feeling them now.
At Grey Road Surgery in North Liverpool, GP Dr Janet Bliss and her team have for years seen how poverty can badly affect health.
Living in that kind of chronic stress does really bad things to your blood pressure and to your metabolism. And, can lead to, illnesses like kind of diabetes.
Now the rising costs are making a bad situation worse.
We're seeing people limiting the amount of meals they will eat in a week, consciously planning to miss meals. We're seeing people deciding to not to collect medications, not to pay for prescription items. We're seeing the impact on transport costs. And also things like kind of data for your phone, so in order to access, vital services that will support their health.
The rising costs of basic foods, fruit and veg, bread, cereals and pasta, is an obvious cause for concern. So in Darlington, in the northeast of England, an innovative mobile food club is helping people continue to eat healthily. For just £7.50, you can get £35 worth of fresh fruit, veg and meat. Essential for someone like Marge, for whom this project offers a real lifeline.
There we go, so free for you today, you'll just hand that to the van.
At the moment I have to count every penny to make sure I got for the nappies, I got for the cream, I got for the wipes. And now, for example, he's 5 months, so soon I'll be weaning him off the food. So this saving will allow me buy him some better veg, better fruit, so he can actually have a good start in life. Without it, I don't know what I would do. In one of the wealthiest countries in the 21st century, I have to worry about feeding my babies, which is, I would say, really, really sad.
There you are. Thank you very much. See you later.
And Steve, who lost his job during the pandemic, now trying to give his 3 growing teenage sons a decent diet while struggling to pay the bills.
We're no different to any other family in the UK, so things like this, and certainly from a health point of view, they are packed with fruit and veg, stuff that we wouldn't normally try, and it gives us that impetus as well to try things different, new, that we wouldn't normally buy as well. So yeah, it's difficult, and it's going to get worse, and it's going to get harder, and we're at the bottom end of the sort of chain, and unfortunately it's going to get to the point, I'm sure it's sometimes in October even, as that we're going to have to make decisions of meals and things that we wouldn't have had to have made before.
Schemes like this offer people the chance to stay healthy even as budgets are squeezed. But no one believes the pressures on family finances will ease anytime soon, and that has implications for our health too. Dominic Hughes, BBC News.
So let's talk through some of the things you heard a moment ago there. One of our regular GPs, Dr. Helen Wall, is with us. Morning, Helen.
Morning.
And with her is Hope Hevingham, who manages a community centre supporting local people with a rising cost of living. That's in Telford. Good morning, Hope.
Morning, Hope.
Good morning. Yeah.
What an appropriate name for someone who helps people with trying to deal with things. Tell us about, you're going to be in your centre this morning, aren't you, a little bit later on?
Yeah, I'll be going there after this.
Go on, I'm sure there's not an average day, but you start the day. What happens next in terms of the challenges you're having to help people with?
So the centre on a day-to-day basis does a variety of things. Usually first thing in the morning, what we do is we have a community fridge which has surplus stock from supermarkets, and we fill that up. It's free to the community to use. People can take as many items as they want. We have a cookbook next to the community fridge that teaches people how to cook using the fruit and vegetables that are in there. It's a big part of our community fridge. It was an initiative started by Brookside Big Local. They are a national lottery funded community group, and we support the delivery of that.
Well, it's such a simple and obvious idea, isn't it, that food should be used. Now, the report particularly we're looking at today is about people skipping meals and their general health and well-being being affected. What are you seeing?
So we've seen that our community fridge is being more used now. When the deliveries come in, we've got a queue of people waiting to come in and take their food, because one of the costs people cut is their food bill. We also distribute food parcels from Telford Crisis Support, and we help with the referrals on that side. We've seen more food parcels through that. We give out breakfast parcels to children on free school meals. They are on the increase. And in the school holidays, Telford and Wrekin Council fund a happy, active, healthy holiday programme for children on free school meals. And we've seen more children being referred onto that as well.
Helen, hearing Hope, all the work that's being done, and what I'm hearing as well is that there is more demand. And with more demand comes, and we've spoken about this before, the difficulty, just first of all, of asking for help. Then going to the community centre that Hope works in. That's hard. And then having to go more. And that emanates as stress, doesn't it? And so what are you witnessing now?
I think you've hit the nail on the head there, Naga, really. I mean, a basic human need is dignity, isn't it? And what we're seeing is people who are genuinely embarrassed to come forwards for help. So the work that Hope is doing, and we've got similar schemes going on in Bolton where I work, is just really great because it's just sort of normalising it. And I know there's a lot of criticism. We shouldn't have to normalise this, that people are having to rely on charities and support. But unfortunately, that is where we are at now. And I'm seeing a massive number of people struggling with their mental health because of this.
And the problem then that we're also hearing is that when help is available, where help is available, and that's an if in itself, is that people are cutting back even further, so skipping meals, maybe even paring back medicine that's prescribed, that's absolutely necessary.
Yeah, I mean, I've got patients who tell me they've disconnected their cooker, they're sitting in the dark at night, they're living on toast because the toaster doesn't use much energy. So we're not even at the point now where people can't buy the food. We're at the point where they don't want to cook the food because their energy bills are so high. So, you know, it is a massive problem, and I've really worried, as many people are, that this is just going to get worse because at the minute we're in summer, aren't we? And you know, heating isn't a mega issue, but once winter hits, the cost of fuel goes up again. You know, what's going to happen? We're going to be in a real crisis.
Hope, I dare say, given the nature of your work, you probably get to know people fairly well in a funny kind of way as they come in, you know, one day after another. Obviously, no names here, but are there individuals who you think illustrate what we're talking about here, who you've seen, who've talked to you about the struggles they're having?
Yeah, I can think of a lot of families.
Like what? What kind of situation are we talking about?
I mean, it varies. Brookside's a very diverse little area. We've got families that are struggling, you know, two-parent, both working households with 4 or 5 children in. They're struggling. I've got people, single occupancy flats, you know, that are struggling. It's so varied, the type of people that are being affected by this.
And do you see evidence of what we were talking about, Helen was talking about there, of people skipping skipping meals, or people saying, you know, I need to have stuff for the kids maybe, and you're thinking, well, there isn't enough. You're not taking enough food away.
Yeah, definitely. We try and support them through everything. You know, if they are scared of putting their oven on to cook because it's using too much gas and electric, we'll help them get a gas and electric voucher from Telford and Wrekin Council's discretionary team. We can make sure that their food parcels have got stuff like pot noodles in that they can use a kettle on, which although is nutritionally not the best, it's something, and something's always better than nothing. So we've got workaround methods, but obviously the service is stretched.
Helen, when it comes to medicine and when it comes to people who are thinking, I can't face the prescription charge, and it's like Hope said, you've got families both working, you know, two-parent families, both working, felt that they were comfortable, and it's just slipped just into the unmanageable. Is there any help on offer when it comes to prescription charges, or, you know, being able to have conversations with their GPs?
So many patients will ask for a longer prescription, and, you know, our guidance is that we don't prescribe. The guidance is 2 months, and we don't really prescribe more than 3 months, because we have to be safe with prescriptions. You know, we can't just give people a year's worth of prescriptions without monitoring those drugs. So it is really tricky, because we've got to always balance that with safety. You can get an annual prepayment certificate, so you pay a one-off charge for the year, but again, that's a big outlay for families who are struggling to, you know, to put food on the table. But it's having effects on health now, not just mental health, but physical health as well. You know, even if we just talk about people being stressed, we know that people who are stressed have high cortisol levels. If you have high cortisol levels, you don't fight infection, you acquire infection better, you don't heal properly. So even, you know, removing the anxiety, the depression, the severe mental health problems that are coming from this, even at that lower level, it's going to have a knock-on effect on physical health. And in the longer term, I suspect we're going to see more obesity, more diabetes, more cardiovascular problems, because we know that food that is nutritionally not the best is cheaper to buy.
Good talking to you. I know it's only a tiny team, isn't it? It's you and one other, isn't it?
Yeah, so it's me and our admin assistant Lydia and a team of volunteers.
Well, good luck to you. I know you're back at work today, so good luck to you, and thank you for all the work you're doing. Lovely to see you this morning, Helen.